Welcome to Being Well. I'm your host, Lori Casey, and today I've got Jean Shobe from the Family Caregiver Resource Center, part of the Lifespan Center in Charleston, Mattoon, or sort of between Charleston and Mattoon, correct?
Yes.
Well, tell us a little bit, for people who don't know what the Lifespan Center is, can you explain what it is and some of the services that are provided out there?
Okay. The Lifespan Center came to be from two different senior centers. We took the Mattoon Senior Center and the Charleston Senior Center, and we brought them together at the Lifespan Center. We're kind of centrally located that way, and it's easier for us to provide services all being under one roof instead of two. And it was 4 years ago, I believe, that we were at that we came to the Lifespan Center. We provide several programs under the auspices of the Council on Aging. We have the RSVP program, we have the Telecare program, we have Dial-A-Ride, we have TRIP, and we have the Family Caregiver Resource Center.
For which you are the head of.
Yes, I'm the program director for that one.
Okay, which is why we brought you here today, because our topic is dealing with aging parents, and that's what your area does. So talk to us about your job and what sort of areas do you cover in your position?
Well, the Family Caregiver Resource Center is, just as it says, it is a resource center for caregivers of individuals over the age of 60. So we, if it's a caregiver who's 18 caring for their grandmother, so long as the older adult is over the age of 60, we can provide services for them. We don't turn away anyone else. We still provide those services, but because of funding, that's the definition of a caregiver. We also provide services for grandparents over the age of 55 raising grandchildren.
Okay, so it goes the reverse way as
Right.
well.
So we have two sets of caregivers that we provide services for, and we do information, assistance, referrals, of course resources. We have some support groups. We do training and education sessions, and in some instances we are able to find some financial assistance to help in whatever the case may be. So.
Okay. Well, let's get into our topic here. And what are some signs that, and we're going to be going from the perspective of the child caring for the aging parent. So what are some things that we should be looking for, signs that maybe our parent needs some additional assistance?
First and foremost, I would say watch for falls or injuries. If there's a more frequent happening or occurrence with falls, or if they're coming up with bumps and bruises that they can't explain, you need to look into that a little more to see what may be causing that, whether it's a medical issue or something around the home that's causing it, to make sure the home is safe. No throw rugs, things like that. Also finances, if you keep an eye on finances to where they're not getting delinquency notices on their bills, or they're not paying the same bill twice, notices from the bank, issues like that that come up with finances. And the third thing I would say to watch for would be hygiene, as far as personal hygiene or housekeeping. Hoarding issues, things like that are coming up. If you notice there's more of a frequency for those things, keep an eye out for that.
So as the child, if you come over to mom or dad's house and you see some of this stuff, how do you start the conversation with mom or dad about that? Because it can be a sensitive one. They want to maintain their independence. So what advice do you give to people about how to even broach that subject?
It's, as you said, it is a delicate situation. A lot of times we would recommend that honesty be the best policy, of course. Openness, making sure that they are aware that you're not looking for a reason to take away that independence. And they're comfortable with talking about the situation. Sometimes, they're fearful of what could be the outcome of that conversation. So just being open and honest, I think, would be the best way to handle bringing those situations up.
So do you have clients that come into your office and say, my parent is so resistant to this?
Absolutely.
How do you address that?
Resistance is tough because as the child, we want to fix it. We want to just go in, kind of steamroll and just say, don't worry about it, I'll take care of it. And we'll put it together and we'll fix it. No problems. You don't have to worry about a thing. But we can't. They have their right to independence. They have their right to self-determination. So it is a difficult situation, whereas if it was our child, we could take care of it because they are an individual, an adult. There's more to think about. But
so sometimes some of this may come up because your parent is hospitalized maybe for a fall, and you may have someone come in, social worker or something, that talks to you about maybe some future care for your parent. What, in that situation, what are some things that you as a child should be asking about mom or dad's future care if they're in a hospital and you're at that stage where you've got to make some decisions? They're maybe not going to be able to go home. What are some of the good questions that we should be asking if we're in that scenario?
You always want to know about rehabilitation. You want to make yourself aware of what they're going to be facing in recovery, whether it's a disease process or whether it's an injury caused by a fall, or if they have a broken bone. What can you expect as a caregiver in the healing process? You also want to make sure that the individual, the patient, is aware as well that it's going to take time and this is what they need to do, because as the adult gets older, a lot of times that rehabilitation is accompanied by a nursing home stay, and that can be difficult. They're fearful again of what could happen, and is this going to be a permanent thing?
I've got some people in my life who are in the middle of that situation right now, and it is very difficult. And one of the difficulties that has come about is when there are siblings involved, and not everybody is on the same page. So how should we deal with, maybe you've got 3 siblings and the parent, to get everybody on the same page so that everybody's giving mom or dad the same information?
Yeah, because you have so many different dynamics and different personalities involved with a family, especially with multiple siblings, we can recommend a family meeting.
Okay.
If you can get everyone together, whether it's by phone conference, whether it's actually getting someone together or getting everyone together in one room, you can throw out those questions and concerns. And it is important to include your care receiver as well, so they're not thinking that you're ganging up on them. That everybody met and talked about them, but they didn't include them in the decisions. So it's important to keep them included.
Do you think that happens a lot, where the children sort of take over and treat mom or dad like the child?
They do. And that kind of goes back to the question earlier, where it's difficult because we want to fix it. We want to make sure that mom and dad are cared for the way they cared for us.
Right.
And it's easy to try to take control and think about what you want and not what they want.
I would imagine if it's possible, you may want to have a conversation with your parent before they get to that state, maybe before they're in their 70s, 80s. Start the conversation now. What are some of the things that you should be talking about with your parent, and what different top areas?
Advanced directives is a big one.
Okay. Which means what?
Powers of attorney, living wills, your actual will. All of those things need to be done ahead of time. And it's important for the caregiver or someone to have copies of all of those papers. A power of attorney isn't valid until the care receiver is ready or incapacitated in some way, but you still need to have copies of those, so when you're at the hospital or wherever, you can present that paper and say, this is what or who I am. And the will itself, I know a lot of times they don't want to divulge until the last minute, but it's important to know at least where a copy of that is, so that it can be accessed if needed. Same with insurance policies, things like that. You want to make sure that the caregiver knows where those things can be found.
Okay. So if someone is given, say in my situation, I'm given the power of attorney over my parents, what does that mean? I mean, what kind of authority do I have?
In the event that the care receiver would become unable to make their own decisions, what's best for them, a lot of times that means they're unconscious or they've progressed in a disease to where they're not able to make those decisions. That's what it comes down to. They're incapacitated in some way. And it actually would give you the authority, as defined in the document, to make decisions on their behalf. And there's a list of things in the document that would be checked, and then at the end you would sign what it would be for.
Okay. So power of attorney is completely separate than someone who's the executor of a will.
Yeah.
It's a totally different thing.
Your power of attorney can be for health, or it could be for finances.
Okay.
That's two different documents.
Okay, so starting a conversation now before your parents get to that, the state where you have to make those decisions, talk about advanced directives. What else should we be talking with our parents about?
Well, that's the big one, making known what their wishes are.
Should you even get into talk about funeral choices and things like that?
Funeral choices is not a bad one. Finances is another
Right.
big one. Making sure, again, that whether there's someone else on the account, or making sure that all the accounts are known. The insurance policies, again, just making sure that you're well informed. A lot of times that's difficult because our parents don't want us to know exactly where they are financially, or with the advanced directives they're saying, well, I can make my own decisions, but it's not always the case. So it may take a few conversations to get them to soften up and be receptive to what you're trying to do. And again, make sure that they understand that you're not out to get them, that it is something that you want to do to help them.
Okay. So we have in our community, and a lot of communities around Central Illinois, lots of different local resources for helping the elderly. Can you talk about some of the resources that you direct towards people who come into the Lifespan Center for, ways of helping, an elderly person with maybe meals or housekeeping?
Most commonly, it is requests for meals, housekeeping, living situations, as far as you mentioned, assisted living or nursing home facilities. The housekeeping seems to be a big issue because to remain independent, like I mentioned, hygiene is a big one, and you want to make sure their living conditions are safe. So those are the most common ones. Another one we get are requests for support groups, where caregivers can go and discuss what's going on, if it's normal, if other caregivers are experiencing the same thing. So those are questions that can be addressed in the support group. And I for one, am a big advocate for that, because they do draw a lot of knowledge from the other ones in the room. So.
And we have, here in our region, we have resources for meals to be delivered. What do we have here locally for senior citizens?
Yeah, there are services to deliver it to the home, and they can provide weekend meals as well, or evening meals. That way they, are sure to have a fresh meal. I think the weekend meals are frozen actually, but then they would still have that to where they could pop it in the microwave and still have food. So
if someone is watching and they're in the middle of this situation right now, there are a lot of resources out there. You don't have to kind of go it alone. There are ways because sometimes what might happen is my parents live 600 miles away, which happens with a lot. The parent here is here and the child is here. They're too far apart, so you've got to find local resources until maybe you can get there.
Right. We do have services that we can connect you with as far as area agencies on aging. That's a network that every state has, and we would just match whatever county your parents are living in to which area agency on aging is covered by that, or covers that area. And then that would be your contact point to find local resources in that area.
So being a caregiver can be stressful, for an elderly parent. Do we have support group? You said through Lifespan there is a support group for caregivers?
There are a couple different support groups for caregivers in the area. We have a couple that are disease specific for Alzheimer's, and then we have a couple that are just strictly caregivers for individuals with all kinds of different diseases and needs. We have one that meets in Charleston, one that meets in Mattoon, and then the two Alzheimer's groups meet at the Lifespan Center.
Okay. So what kind of advice would you tell people who are caregivers who, it can be, it's stressful, it's hard. how can they, continue to provide the care that they need for their parent and still, have a life for themselves and sort of find some level of balance between all of this?
Caregiving is hard to find balance in, because it's kind of like having children of your own. You want to make sure everyone is cared for, everything is just right. So finding that balance and managing the stress that goes along with it, I recommend finding any resource that you can. Again, I go with the support groups because they are a huge help, and then just taking one day at a time, because depending on what the caregiver is dealing with, one day at a time, one step at a time is the best that you can do. And just know that you're not in it alone, that there are other people doing the same thing.
Are there, you had mentioned earlier in the interview things that we should be looking for if our parent may need assistance, either falls, injury, finances, hygiene. I would think another one might be forgetfulness, early signs of dementia, or that comes in all different levels. So how do you recognize that? What are some of maybe the early signs that it's something beyond just, oh, mom's is getting up there in age and can't remember certain things?
I'm not an expert on dementia or dementia type diseases, but a lot of the caregivers that we connect with are dealing with that, and they get concerned early on, and I would just recommend that you keep an eye on it, check in on them if you think it is more of a concern. Try to talk to medical physicians, nurses, just let them know. I know with confidentiality, it's difficult to get any information from the medical field, but you can let them know what you've observed, and then it would be helpful for them in making their decisions too.
What sort of things, if you're able to accompany your parent to the doctor for their regular visits, what are some of the things that you as the caregiver should be taking notes on and being aware of to sort of help them in their, as to be an effective caregiver? What are some of the questions that we as the caregiver should be asking the doctors?
That's difficult because a lot of the times when you're sitting there with your care receiver, and it's hard to put out the questions honestly without, you're afraid that you're going to offend the person that you're providing the care for. And questions that you could ask, or not necessarily questions, but things you could point out, are things that have happened in the past that you may be concerned about. Now, they may just kind of, put it under the rug, that, oh, that wasn't a big deal, but the physician at least is aware that those types of things are happening.
I would imagine another area that's important to keep track of is the medications that your parent is on, and keeping that list handy to make sure that they're taking the right dose at the right time.
Yes, medication is tricky sometimes. A lot of caregivers will pull in their homemakers or housekeepers to do medication reminders. If they're with an agency, they can do that. But in a crisis situation, you want to make sure and have all those listed, and the dosages and how many times they take them. One other thing I wanted to point out about going to the doctor with a parent is that when you go to the doctor, you've got your questions and things you want to ask, but it's important to write things down that the doctor says, because when you get out of the doctor's office, your parent may not have comprehended or heard everything that was said because they had so many other things on their mind. So it's good to take somebody with you so that you have a second opinion, basically.
And two sets of ears hearing.
Exactly.
Hearing that. Are there other, as we wrap up here, are there other things, tips or something that you could help us with as we leave to sort of make that transition from, child to caregiver a little bit easier? Because we do want to care for our parents. They cared for us. We're just returning the favor, but it's a difficult process. What can we do as the children turned into caregivers to make that a little bit easier on mom and dad?
It's important to maintain that respect level, and just respect that they do have rights, that they do want to remain independent as long as they can. Be open and honest And again, remember that you're not the only person going through this. There are resources that can help, and then there are other people going through it as well. So don't be afraid to reach out and ask for help, because it's not a sign of weakness if you can't handle everything. I mean, that's actually a smart decision to know that you can't do it alone. You need the help and support of others.
And there are probably a dozen other people going through the same thing you are.
Exactly.
So seek out those resources. You know, here in the Coles County area, we have Lifespan Center. Communities around have other similar resources. So, Jean, we want to thank you for coming on, being well, and we appreciate the information you provided us.
All right, thank you.
When temperatures go up, so does your risk of heat-related health issues, dehydration, heat exhaustion, or heat stroke. Paying attention to the heat is especially important if you have a chronic illness such as diabetes. Here's what diabetics need to know about staying healthy in the heat.
I gotta give you a decent pitch.
To Teresa Brown, there's nothing like a family game of backyard baseball.
Nice hit.
Teresa has type 1 diabetes. She has to be careful when the sun soars.
If we know we're gonna be doing something that's gonna be fairly active, then I need to plan ahead.
Diabetes patients in particular are susceptible to the heat. Not only do they have to worry about their health, they also have to worry about the impact of hot weather on their equipment, their medications, and their supplies.
Mayo Clinic Dr. Curtis Cook says dehydration can happen to diabetic patients quickly in hot weather.
Many times patients lose the ability to cool themselves in the heat.
And high blood sugar levels also put them at risk of dehydration.
And if you get really warm and you're not hydrating like you need to, I think it gets blurry as to tell, am I just feeling this way because I'm really warm, or am I feeling this way because something's going on with my blood sugar?
So Teresa stays hydrated
Drink plenty of water.
and checks her blood sugar before
See, it's actually high right now. It says 194.
and after playing in the sun.
I'm doing good right now. This is good. I'm headed in the right direction.
Teresa's on an insulin pump that constantly delivers medication. It's essential that she keep her medication and equipment cool. Heat can damage the technology, even the test strips, and it can make insulin less effective.
Then the insulin can start to break down, and then it's just not going to work like it needs to in my body.
Insulin helps Teresa's body metabolize glucose, sugar.
Makes it more fun when you got to work for it.
So she's vigilant and
There you go.
takes care to stay healthy in the heat so she can pitch a perfect game to her family. For Medical Edge, I'm Vivian Williams.
If you're heading to the beach, you probably don't have water quality concerns at the top of your list. But some beach water is dirty and may even make us sick. Elizabeth Cohen takes a look at how our beaches are faring in 2013.
The latest report card on the health of America's beaches finds that for the third consecutive year, there have been more than 20,000 closings and advisory days due to dirty water. The report is put out each summer by the Natural Resources Defense Council. The number of closures and alerts for 2012 are actually down from the year before because we had less rain and therefore less runoff, one of the major sources of pollution to our waterways. About 80% of these closures were issued because bacteria levels exceeded public health standards. Raw sewage may be partly to blame. Illnesses linked to swimming in contaminated water can include upset stomach, skin rashes, ear, nose, and throat problems, pink eye, respiratory infections, and hepatitis. Young children and older people are most at risk. To find out how your beach rates, you can go to www.nrdc.org/beaches and then plug in the zip code. For today's Health Minute, I'm Elizabeth Cohen.
Heart health may be the latest reason not to start your day on an empty stomach. According to a new Harvard study, having breakfast may keep you from having a heart attack. Researchers studied 45 to 82-year-old men who work in the medical field. They found those who skipped breakfast showed a 27% increase in heart attacks and coronary heart disease risk. Even though the study was done on older men, researchers say the results will likely apply to the broader population. The men who skipped breakfast were also more likely to smoke, be less physically active, and drink more. Stress can play a huge role in your health. Studies have found a stressful life can cause high blood pressure, heart disease, and obesity. That's right, stress can even cause weight gain. Why? Mary Ellen Hopkins has the details.
No doubt about it, we live in a stressful world. And doctors say when we're stressed, we may not eat as well as we should. Psychologists at the Mayo Clinic have found that during very stressful times, people tend to eat to fill an emotional need, even when they're not hungry. And that can include snacking on comfort foods that are often high in calories and fat. It's sometimes referred to as emotional or stress eating. Doctors say there are ways to handle emotional eating. First, get a handle on the stress. People who are in control seem to stick to better eating habits and exercise more. What's the best way to handle stress? Try these tips. Recognize stress and the warning signs like anxiety, irritability, and muscle tension. When eating, ask if you're really hungry or just eating to eat. Don't skip meals, especially breakfast. Don't have comfort food like potato chips and candy available in your home or office. Practice relaxation exercises such as yoga and meditation. And get plenty of sleep. Doctors say feeling more comfortable with your inner self can cut down on inner stress and therefore cut down on emotional snacking. For today's Health Minute, I'm Mary Ellen Hopkins.